Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. It's nice to see you again. How have you been feeling since our last appointment?
Good morning, doctor. Well, no, I've been managing, but the knee pain from my osteoarthritis has been pretty persistent. I've been taking the ibuprofen you prescribed, which helps a bit, but the pain still feels quite high, especially on some days.
I'm sorry to hear that. Can you tell me more about how the pain has been affecting your daily activities?
Sure. The pain usually starts in the mornings when I wake up, and sometimes after I've been sitting for a while. Getting out of bed or standing up can be really tough. Walking around the house or running errands isn't as difficult as it used to be, but it still takes a lot out of me. Climbing stairs is becoming increasingly challenging, and I've had to cut back on some of my activities because of the pain.
I understand. Have you noticed any changes in the intensity of the pain throughout the day?
Yes, the pain tends to fluctuate. It starts off pretty intense, around an 8 out of 10, and after taking ibuprofen, it usually comes down to about a 6. But there are days when even that level feels overwhelming, especially if I've been on my feet for too long.
Have you tried any other pain management strategies aside from ibuprofen and tramadol?
I've been using heating pads on my knees, which provide some relief. I also tried stretching exercises a few weeks ago, but I found it hard to stay consistent because of the pain. I haven't started physical therapy yet, but I've been considering it as an option.
It's good that you're exploring different methods. Let's talk a bit about your overall health. How have you been managing your blood pressure and diabetes?
My blood pressure has been a bit elevated lately. Last time it was 143/70. I'm taking lisinopril, amlodipine, Bumex, and metoprolol, but I've been having trouble keeping up with the metoprolol regimen. I was supposed to take it twice daily, but I've only been taking it once because I sometimes forget the second dose. My blood sugar levels have been controlled, staying in the 140s to 150s, and my last A1C was 6.6, which I'm pretty happy about.
That's good progress on your diabetes. We'll need to address the blood pressure management. How about your cholesterol levels?
My cholesterol levels are within normal limits, which is a relief. I was worried because of my history, but everything seems to be under control there.
That's excellent. How are you handling your medications overall? Any side effects or difficulties?
Mostly, it's been manageable. The only issue is with the metoprolol, as I mentioned. Sometimes the ibuprofen gives me a bit of stomach discomfort, but taking with food helps. Other than that, I haven't noticed any significant side effects from the other medications.
Understood. Let's discuss your lifestyle a bit. You mentioned working night shifts. How is that affecting your sleep and daily routine?
Working night shifts has really messed with my sleep patterns. I usually try to sleep from around 10 a.m. to 3:30 p.m., but it's not always consistent. I often feel tired during the day, which probably doesn't help with managing my pain or keeping up with my medications.
Sleep is crucial for overall health, so we'll keep that in mind. How about your diet and physical activity?
I try to eat a balanced diet with plenty of vegetables and limit sweet and high-fat foods. I do have fried foods occasionally, but I'm making an effort to keep them to a minimum. My BMI is 31, so I'm aware that I need to manage my weight better. Exercise is limited because of the knee pain, but I try to take short walks when I can. I'm not very active otherwise.
Managing weight can indeed help with the knee pain. Have you considered any weight management programs or support?
I've thought about it, but I haven't taken any concrete steps yet. Maybe with better pain management, I could be more active and start something like that.
That sounds like a good plan. You also mentioned a history of smoking in the 1970s. Have you had any respiratory issues since then?
No, I haven't had any significant respiratory problems. I quit smoking a long time ago and have been mostly healthy in that regard.
That's good to hear. Have there been any other health concerns or symptoms you'd like to discuss?
No major issues, but I am a bit worried about my blood pressure. Also, I'm considering retirement soon. I want to focus more on personal activities, like fishing, but I'm concerned about how my health will impact that plan.
Retirement sounds like a wonderful goal. We'll work on managing your health to support your plans. Now, let's go over your recent lab results and vital signs to get a clearer picture.
Okay.
The X-rays of knees showed joint space narrowing and subchondral sclerosis, which are indicative of advanced osteoarthritis. Your echocardiogram from last year showed normal left ventricular function with an ejection fraction of 60%, which is good. Given your history of smoking, we plan to conduct an abdominal ultrasound to check for aortic aneurysm.
Yes, I remember you mentioning that.
Based on everything we've discussed, here's the plan. To better manage your blood pressure, we'll increase the dose frequency of metoprolol to twice daily as originally prescribed. I'll also renew your tramadol prescription for pain management to help reduce your reliance on ibuprofen. The abdominal ultrasound will be scheduled to screen for aortic aneurysm due to your smoking history. You'll continue with your current medications and will monitor their effects closely. Additionally, we'll schedule a follow-up in 6 months to recheck your cholesterol and other parameters. I'd also like to discuss potentially increasing your dietary fiber intake to improve bowel movements.
That sounds comprehensive. I'm glad we're addressing these issues. I really want to enjoy my retirement and fishing without being held back by pain or other health problems.
Absolutely. Managing your pain and blood pressure effectively will be key to maintaining your quality of life. If you have any concerns or experience any new symptoms before our next appointment, please don't hesitate to reach out.
Thank you, doctor. I appreciate your help.
You're welcome. I'll have the prescriptions renewed and set up the ultrasound appointment for you. Take care, and we'll see you in 6 months.
Thanks again. Goodbye.
Goodbye.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi, doctor. Thank you for seeing me today. I've been dealing with this persistent cough for a while now, but it seems to be getting worse lately. It's especially bad later in the day, usually after I've eaten. Lately, I've also started experiencing these heart palpitations whenever I cough.
I'm sorry to hear you're going through this. Can you tell me more about when the cough started and how it has changed over time?
Sure. It started about 6 months ago. At first, it was just a mild cough, but over the past few months, it's become more frequent and severe. It's particularly bad after meals, which makes me think it might be related to my acid reflux. I've had acid reflux before, and the medications I took back then actually caused me to cough more, which was really frustrating.
That does sound challenging. Have you noticed anything else that might be related to your cough or the palpitations?
Well, aside from the cough and the heart palpitations, I haven't had much relief from the reflux medications I've tried. I'm not taking any over-the-counter remedies like Sudafed right now. I also don't have a history of smoking, which I know can cause coughs, so that rules out one potential cause. I've been trying to stick to low-acidic diet and even monitor my pH levels, but nothing seems to help. I've stopped drinking coffee and switched to tea, but the cough persists.
I see. You mentioned that the heart palpitations started recently and are associated with coughing. Have you had any other symptoms like dizziness, shortness of breath, or chest pain?
No, nothing like that. It's just the palpitations that come with the coughing spells. I did have some tests done last year, including a stress test and checking my TSH levels, cholesterol, and pulmonary function, but everything came back normal. Despite following the medical advice and trying different treatments for acid reflux, my symptoms haven't improved, which is really frustrating.
I understand how that can be frustrating. How has this affected your daily life?
It's been quite disruptive. The persistent cough interrupts my work and social activities. The heart palpitations are scary and make me anxious, especially since I don't fully understand what's causing them. I'm really frustrated with the lack of improvement despite following all the recommendations. I feel like I'm just going in circles without a clear diagnosis or effective treatment plan.
That sounds very difficult. Have you noticed any specific triggers besides eating that make the cough worse?
Not really. It seems to be more related to the timing after meals. I also don't have any symptoms of postnasal drip or sinusitis, and my chest x-ray didn't show anything acute. I've been trying to avoid acidic foods and sodas, and I haven't noticed any improvement from those changes either.
You've been very thorough in managing your diet and following up on your symptoms. Can you tell me more about your lifestyle? For instance, your work, stress levels, or any other factors that might be relevant?
I work a desk job, so I'm pretty sedentary during the day. I've been trying to stay active by walking in the evenings, but the cough makes it hard sometimes. Stress-wise, it's been up and down, mostly related to dealing with these health issues. I don't consume much caffeine anymore, only occasional tea. My family has a low acidic diet, and I try to keep up with that, but it's been tough to manage everything on my own.
It sounds like you're making significant efforts to manage your condition despite the challenges. Have you had any recent investigations done to further explore your symptoms?
Yes, last year I had an EKG, and it didn't show anything concerning. The doctor suggested doing a Holter monitor and an echocardiogram to get a better look at my heart rhythm and structure. There's also been talk about possibly getting an upper GI study to investigate my reflux more thoroughly, but I haven't started that yet.
Those tests should help us get a clearer picture of what's going on. Given your symptoms and the lack of response to initial treatment, it's important that we continue to investigate both the respiratory and cardiac aspects. Is there anything else you'd like to share about your symptoms or concerns?
I guess I'm just really hoping to find a definitive diagnosis soon. It's hard not knowing what's causing all this and feeling like the treatments aren't working. I'm also hesitant to start new medications without understanding the underlying cause better. I want an effective treatment plan that addresses the root of the problem, not just the symptoms.
I'm so busy with my personal and professional life. I will start.
I completely understand your concerns and frustration. We'll work together to get to the bottom of this. Let me summarize your current status. Your vital signs are stable, with a blood pressure of 130/85, heart rate of 88 BPM, respiratory rate of 18 breaths per minute, temperature of 98.6 degrees Fahrenheit, and oxygen saturation at 97% on room air. Your laboratory results are within normal ranges across the complete blood count, basic metabolic panel, liver function tests, and thyroid function tests. Your chest X-ray and sinus X-ray didn't show any acute issues, and your spirometry results are slightly below predicted values but not significantly abnormal. Given your persistent cough, especially postprandial, and the new onset of heart palpitations, we need to proceed with the planned investigations. These include wearing a Holter monitor to capture any abnormal heart rhythms over a 24-hour period, scheduling an echocardiogram to assess the structure and function of your heart, and potentially conducting an upper GI study to evaluate the extent of your reflux and rule out any complications like a hiatal hernia or Barrett's esophagus. Our assessment is that your symptoms may be multifactorial, potentially related to gastroesophageal reflux disease, that might be causing both the cough and triggering the heart palpitations through vagal nerve stimulation or other mechanisms. However, we need to rule out any cardiac causes given the palpitations. The plan is to proceed with the Holter monitor and echocardiogram as soon as possible to gather more data on your heart's activity. Concurrently, scheduling an upper GI study will help us better understand the role of acid reflux in your symptoms. Once we have the results from these investigations, we can develop a more targeted treatment plan to address both the cough and the palpitations effectively. Is there anything else you'd like to discuss or any questions you have about this plan?
No, that makes sense. I appreciate you taking the time to explain everything. I just want to get to the bottom of this and find some relief.
Absolutely. We'll work together to find the best solution for you. Let's schedule those tests and follow up once we have the results.
Thank you, Doctor.
You're welcome. Take care, and we'll talk soon.